And very good evening to all of you. I'm Sayuka from All About Skin Wellbeing, and today we are going to talk about fungal infections. So let's connect today with our skin expert, Dr. K. Sreedevi, live from Chennai to enlighten us on the topic of fungal infection. Doctor is an MBBS, DDVL, FIAMS, dermatologist, have many years of experience in this field, and currently she is practicing at Sri Guru Skin Clinic. A very warm welcome to you, Dr. Sreedevi.
Namaste all. I am Dr. Sreedevi working in Sri Guru Skin Clinic, Palikaranai, Chennai. Happy good evening to all.
Yes, and doctor, today we are going to talk about fungal infection, and I think this is the right time to talk about it because there's such a surge in the cases of fungal infection. So, first of all, doctor, why we get so many cases of fungal infection, particularly in this season? What gives it that, growth?
Yeah, due to excessive sweating, one reason. Even though in the AC people are sitting, insensible perspiration is there inside the body parts. That's why they will get fungal infections more. And also
Hmm.
temperatures are high at this season, so more cases of fungal infection are seen in the skin OPs.
Okay. Now, doctor, we see a lot of patients going for over the counter creams, and they'll keep on applying it for months, and then we realizes that it's not subsided. Initially, when we use OTC products, it looks like it is subsiding, but we have seen that we end up going to the doctor even after applying over the counter medication. So what is your take on that? Do they
Yes,
really harm us or they help us in any way?
yes, madam. Yes, madam. Sometimes over-the-counter medicines people are using, but
Yes.
sometimes only combination creams are not that much useful, madam. It will
Yes.
reduce only itching sensation, but not it will address
Mhm.
the fungal infections and deeper lesions and multiple lesions. The type of patients cannot be cured with that multiple combination creams. So they will end up with resistant fungus like that, and they will then come to dermatologist.
Hmm. Right. And doctor, we also see a lot of recurrence in case of fungal infection. What is the main reason for that?
Yeah, main reason is the compliance. The patient, if we say 15 days you have to use, they have to use. Sometimes
Hmm.
they may miss the doses or they won't apply the creams properly, and they apply combination creams. And also disease may be associated with other systemic diseases like diabetes with fungal infection or some pregnancy or immunocompromised patients. That time it will take more time and it becomes resistant. And if they use injudicious use of fungal treatment will also cause resistant cases.
Okay. Now, doctor, we always say, especially in medical field, that prevention is always better than cure. What are the ways we can prevent having fungal infection?
Yes, fungal infection. Better to use cotton dresses, loose cotton dresses, somewhat 1 or 2 inches extra size they have to purchase. And afterwards, they have to take bath 2 times a day. And also, they should not share their towels and clothes. And even fungal infection are there, they have to wash their clothes separately in the washing machine. And drying under sun rays is helpful.
Hmm. Okay. When a patient comes to you with fungal infection, or maybe as a layman, the patient is not aware what kind of infection or allergy is there, do you normally recommend any test, or just by physical investigation you're sure that this is fungal infection? What is the way to diagnose, doctor?
Yeah. Yeah, for fungal infection, usually you can observe the case and we can diagnose. Another
Hmm.
tests are there like KOH, potassium hydroxide mount, like that. But
Hmm.
symptomatic symptoms and the signs will itself able to diagnose the case easily by doctors.
Right. What are the
And also
common
some patients,
areas?
it is a old disease.
Okay.
Yeah, old
Right.
disease. So patients can understand it is fungal infection most of the times.
Okay. Okay. Doctor, which are those body parts which are more prone to having, fungal infections?
Yeah, fungal infection is such a vast infection. It may come anywhere from top to bottom, for hairs, face, even beard region. front and back and breast and chest regions, umbilicus, abdomen, groins, axilla and toes, it will come. Grey toes and nails also it will come.
Mm,
Many and
right.
symptoms vary accordingly. Suppose if it is in the hairy region, hair means hair fall is there. Other reasons it may be scratching sensation, itching, erythema, burning sensation may be present in some patients. During in the nail infection stage, there may be brittle nails and some powder-like nails will be there. There is subungual gap may be there in that patients.
Mhm. So, talking about the skin fungal infection, doctor, what are the treatment options and how much time it normally takes to heal?
Yeah, it depends upon the patient's immune status and also the
Okay.
number of patches they are having, which area they are present like that. If a single patch is there, it will be cured in 15 to 15 days like that. 1 month maximum treatment, it will reduce the lesions. If multiple lesions are there, it may take more time. So we have to inform the patient that it may take few days, 15 days to 1 month or 1.5 months like that. You have to use the medicines correctly, then only it will be reduced. Otherwise, it will recur. Sometimes I saw many patients who use for 15 days or 10 days like that. They say that all the lesions are subsided, itching is not there, so we stopped the medicines. Once again, after 10 days, they show small redness in that area and come back to us. Then I said, why should you stop? Means itching is not there, not like that. Sometimes spores may be present on that area. Even though the lesion redness is disappeared and itching stopped, that outer line, outer border may be having the spores and it may grow after a few days. That's why you have to continue the treatment. Don't discontinue as you like that. I told them. We are
Right.
telling
You
them.
need right. You need to follow the advice given by the doctor. You need to follow the prescription. Don't discontinue your medication all by yourself. Consult your doctor in case there is anything which is bothering you. Now, doctor, because we have talked enough about the skin-related fungal infection, we would like you to throw some light over nail fungal infection. Who are those who are more prone to having nail fungal infection, and how much time it takes to get recovered,
Yes,
what is
yes.
the treatment way, etc.
Yeah, yeah. Nail fungal infections may come in diabetic patients, usually diabetes patients. It may come in diabetes patients. Even the toenails or fingernails will appear, and also the persons, workers and hotels, some are working more wet surfaces, they are working those areas, nail infections are common. For fingernails, it may take 6 months to treat the condition. For toenails, it may take 6 months to 9 months. In very many nails are affected means it may take 1 year also. We have to continue the treatment with nail lacquers like that. We have to apply weekly once like that, and surrounding skin also should be protected with the antifungal creams like that. Then it will reduce, definitely it will reduce. Even I saw one patient, 70 years old, diabetic, he is having fungal infection in the groin region, and I gave treatment. At the same time, I observed that toenails also affected, greater toenails. When I asked, the patient told that no symptoms, ma, nothing is there like that. He told me, but I told that color changer is there, brittling powder like scales are there downwards. So I said better to use nail lacquer also for that. So that patient took treatment. After revisiting me, he told, yes, doctor, now I am getting the nail is normal from the edge over here like that. No, that one is nail normal. I am getting. Previously, it is not like that. And then he thought that this may be also source of infection for me, like that he realized.
Hello, doctor. We would like you to tell us about scalp related fungal infection of head. How does it looks like, why it
Yes.
happens, and what are the treatment options?
Yes. Yes, there are 2 to 3 types are there. Sometimes superficial fungal infections will come like dandruff lesions. It may present any age and any age group, and male and females both are equally affected. So cradle cap like that is there in children. Sometimes it will come in the newborn also in 1 year age also. And the children between toddlers and below 10 years age group, Kirian-like infection, 1 rupee coin size lesions. There is hair loss in that area. They may think and they become aggressive, and this patient will become anxious. why there is that much loss of hair like that is also there. There is a boggy swelling in head region in some patients. So children also affected scalp infection, scalp fungal infections frequently. They may be playing outside, sometimes the dust falling on the hairs that will be seen. And also
Hmm.
diabetic patients it will come. And senile patient where the immunity is less, they may have itching sensation in the scalp. Sometimes it may lead to fungal infection also in the scalp region. Yes.
Okay. Doctor, if a member, now again, we are talking about the fungal infection of skin. If a member in a family is affected or infected by fungal infection, or what precautionary measures others should follow so that they don't catch it?
Yes, they should not share the combs and towels or clothes also. They should not share with other family members. They have to use separate. Fungal infection person is there. Their clothes should be washed separately and should be dried under the sun. And these are the precautions they have to take. And also, if they are sexually active people, like couples are there, means they must take precautions. And that person also should take treatment at the same time. Even though the disease is not there, they have to take at least topical treatment. And so, if necessary, tablet also required for the partner. The diseased person is there called active person. The passive person is the next spouse who is not having the disease. Also advised to take some
Hmm.
treatment on that to control the
Okay.
infection, get rid of
Right.
the disease.
Right. Now, Dr. Sreedevi, before we sum up the whole session, any take home message for our viewers how to take care of themselves, especially in this humid condition when there are more chances of catching fungal infection?
Yes, you have to take all precautions. We must see that there should not be much sweating areas, loose dresses, little loose dresses you have to use. And the cotton dresses are better when the season is like that until the season changes. And if necessary, if any rash like 1 rupee coin rash or irregular shape like flower shape, anything you are getting rashes means you have to consult your physician, family physician or dermatologist. You have to consult early the diagnosis and treatment is the better results, and the treatment duration also will be very less. That is my message to the people.
Thank you so very much, Dr. Shridev. It was wonderful talking to you. So now we know that there are preventive measures that we need to follow, irrespective of the fact whether we have fungal infection or not. Plus, in case we have fungal infection, don't go for any self medication, over the counter medication, nothing. Please go to the correct person, which is a qualified dermatologist, and complete your treatment. That's equally important. Take care of yourself is very important. Taking good care of ourselves is very important. Thank you so very much, doctor, for your valuable time and making the whole
Yes.
session so informative.
Thank you,
Thank
madam.
you.
Thank you.
Thank you, doctor, and viewers. Thank you for
Thank you,
your
madam. Thank you so much. Thank you all.
participation. Thank you. Thank you, doctor. And for
Thank
more
you.
information
Thank you so
and
much, madam,
updates
and
on
thank you all.
skincare and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great evening ahead. Goodbye.